Hey, good morning, therapist Lola. My name's Jen. I'm the nurse working with your patients today.
Good morning, Jen.
Good morning. I just wanted to tell you about the first patient we have coming into our clinic this morning. Her name is Devin. She's a 25-year-old female, and she's coming in because she's really concerned about her OCD affecting her family life and her relationships. So she's coming in this morning. So from her chart, it looked like she had a break-in a little while ago, and she's been constantly locking her doors and her windows in her car, and just everything is a lot for her. So she said it's just really affecting her family life and all of her relationships. So I'm gonna bring her in first and talk with her and kind of see what's going on. And if you've got some time after our session to talk with her about some therapy options.
Absolutely.
If she's open to it, I think that'd be great.
Okay, that's fine.
Okay,
All right,
good.
thank you so much, Jen.
Yeah, let me go get her.
Okay.
Good morning, Devin.
Good morning.
My name's Jen. I'm going to be your nurse today.
Okay.
I'm just coming in to talk with you a little bit to see how you are this morning and what's going on.
Okay. So I was living with my roommate for the past 2-3 years. A year ago, our home was broken into, and now I live alone. But ever since then, I just keep checking the doors, checking the locks. Can't stop checking the windows. At this point, it's so bad that my neighbors just asked me to stop locking my car alarm, stop making my car alarm go off.
I gotcha. So you're waking up in the middle of the night, you said, for that?
Yeah,
Okay.
multiple times.
Multiple times, okay. And you said, how long ago did you say your break-in was?
A year ago.
A year ago, okay. So it's been some time. Has it been almost every night?
Yeah.
Okay.
It's constant, every night.
Okay, about how often would you say you get up per night?
Probably like 15 times. I'm usually getting like an hour or two of sleep.
Okay, that's not very much sleep. Do you feel like the sleep is affecting your life too, or just the locking of the doors?
It's affecting my life. I'm supposed to start back work within the next 2 weeks,
Okay.
and I can't imagine going back to work.
Yeah, that's gotta be really tough. It seems like it's definitely taken over a big part of your life.
Yeah.
Have you tried locking the doors just once since this time?
I
or-
try, but every time I try, as soon as I turn away from the door, it just brings back memories, and I think, I know I didn't lock the door.
Yeah. Okay. And has this happened to you prior to this?
When I was a child, my mom told me a story about our home being broken into, but other than that, it's never happened.
Yeah, that must have been a scary situation for her. And you and your roommate were safe the whole time when this break-in happened?
Yeah, we were safe.
Okay, good. And do you have family that lives nearby that you've been able to confide in, or someone that you've been able to talk to about this?
Some of my friends do live close. The stories, they're just kind of the same, so I've done away with inviting people over and trying to have company.
Okay. Okay, and have you considered any other living situations? I know you said you live by yourself now. Have you tried to make other living accommodations or anything?
I thought about it, but I'm really close to my job, so if I can help it, I'd rather not move.
Okay, and you said you do have to go back to work soon. Have you been working during this time?
I've been staying at home because of COVID, so I'm working from home.
Okay. I got you. So you're going back into work. How do you feel about going back in?
Really nervous. If I could just figure out how to leave my home for a period of time without thinking about my doors being unlocked, maybe I could get by. But I haven't been out of the house past an hour since this has been going on.
Okay.
Yeah, I've missed family gatherings, holidays, and it's really starting to affect my everyday life, my social life,
Okay.
losing friends.
Okay, I gotcha. Yeah, it seems like definitely a scary situation. It's a lot of anxiety related to that too. Have you tried any coping strategies?
I've tried to research a little bit myself. Actually, I brought a chart with me.
You did.
Yeah, I've been trying to keep track of how many times I get up throughout the night. I don't know if it's helpful though.
Alright, let's see it.
So I've labeled each with how many times I get up to lock the door,
Mhm.
the car door, and my windows.
In your windows. Is this just within one night?
Yeah.
Okay. So yeah, that makes sense. You're only getting about an hour of sleep. That's a lot of times to get up. You said do you feel like this helps you when you tally it off, that you feel like you actually lock the door?
Sort of, but then I go back and look at the sheet,
Mhm.
and I think maybe I didn't lock the door, so let me go check again.
Okay. I see what you're saying. Okay. Have you been to any other clinics or seen any other doctors for this?
No,
Okay.
that's the first place that I've come to.
Okay. And have you ever tried any medications that you feel like help you?
I really want to stay away from medications.
Okay.
I just don't like them.
Okay. Sounds good. And then we'll look through your chart to see, and we'll go over any other medications that you might be taking too.
Okay.
So some other options we have that aren't medications for you would be with our therapist. Her name's Lola, and I think she's here today, so she'd be able to help talk with you about maybe some cognitive behavioral therapy
Mhm.
type things. And it's not something that would happen overnight and it would just automatically be better. You'd probably have to come back for a few sessions, and we can work with you and monitor your progress too. Is that something you'd be open to?
Yeah. Do you think she'd really help me, or?
I think she would. I think if you're open to it and you're willing to try and see what she has to say, I think it's a good first step for you.
Okay.
And we can talk about some other therapies and options later down the road if you feel like this isn't the best fit for you.
Okay. Will I have to make a decision today, or?
You won't have to make a decision today, but if you're open to talking to her, then you can at least see if this feels like a good fit for you.
Okay.
Okay, well let me go talk to her and see if she's available
Mhm.
and tell her a little bit about your situation. Is it okay if I take this to her and she'll bring it in too? So you
Yeah.
can help explain to her a little bit more. Okay, and do you feel okay staying here by yourself?
Yes.
Okay. Let me go talk with the therapist.
Okay.
Hey Lola. So I just talked with Devin. She is coming in for the break-in, like I told you earlier today. She is getting up multiple times a night, as you can see from the sheet. She said this was just from one night.
Wow.
So it's a lot of times that she's getting up and it's really affecting her everyday life, her relationship with her family and her friends. She said the most she's been out of the house has been for about an hour. So really affecting her social life too. She said she really feels like she's ready to get some help, and I thought maybe the cognitive behavioral therapy or some other options that you have for her would be a good fit.
Okay.
She said she really doesn't want to take any medications.
Alright.
So she's just right in this room if you feel, if you want to talk to her and
Okay, I'll do
see
that.
how it goes.
Okay, thank you very much.
Yeah,
Okay.
thank you.
Come in.
Good morning.
Morning.
Nice to meet you.
You too.
I'm Lola.
Okay.
What's your name, please?
Devin.
Oh, nice to meet you, Devin. Good morning. So what brings you here this morning?
I was living with my roommate for the past 2 or 3 years, and recently our home was broken into. Well, not recently, about a year ago.
Yeah.
And it's just really been affecting my life ever since then. I'm always checking my car doors, always checking my windows, and always up throughout the night to check my locks.
Wow.
I'm starting to disturb the neighbors by making my car alarm go off, locking my car doors. I figured it's time to get help.
Yeah. Alright, thank you for coming in. Once again, my name is Lola. I'm a therapist, and I see from the charts that you actually said this has been going on for more than 6 months. So what we normally call this is a chronic disorder. And this is what we normally refer to as OCD. And that's an obsession, a compulsion one that and is a disorder. And basically it's like a repetitive routine of something that should be done once. And when you go over it and over again, it tends to give you anxiety, makes you less comfortable, and it bites on your time. Because usually what you're supposed to do just for like a sub-second, you find out that you're going back and increasing your anxiety level by going back to check if you actually did like shutting your door or your car door, just like you said. people are beginning to observe to see that this is just like a cyclic circle. And thank you for coming in basically.
Does that mean something's wrong with me? Like, am I disabled or?
Not really, you're not disabled, but it's something that we can work with. I heard Jen say you don't want to go through the pharmacological route. So we have some other options that we can explore if that's okay with you.
Okay.
Okay, like I would like to discuss some 3 points with you, and which are basically called the behavioral techniques that we can use to handle OCD.
Okay.
Yeah. So the first one is exposure and response prevention. The second one is the thought stopping one, and the third one is progression relaxation. So if you have any question while I'm going through the 3 suggestions that I have, because whatever we need to do has to be specified to you, so it depends on you and what you feel much more comfortable working with. So we have 3 options. You're free to choose which one you feel you're more comfortable to work with.
Okay.
Because we want to see progress in you and want you to be much more relaxed and comfortable, so that your anxiety level will be much more down. So the first one is exposure and response prevention, and this is actually a style where you deal with your fears.
Okay.
Because the onset of this repetitive locking of the door, the door to your home and the car, is because of the breaking you had. So that's understandable, but we want to make you to understand that that has happened and is in the past. We want you to understand that once you lock the door, let it be known to you that it's actually locked, and put your mind at rest and move on to other activities. So basically, we want you to, the anxiety that you're feeling to gradually fade away. That's the essence of this, and that's to expose you to going to the door, opening the door, locking the door once, moving in to do some other things. And when you get to your car or get out of your car, you can lock it once and move on to other activities of the day. So basically, those are the things that you're afraid of it breaking. That's why you're repeating the actions. But with exposure and response prevention, you're actually intentional to know that, yeah, I've done this action and I can move on to another one.
Okay.
That's the first one.
And what's that one called?
That is called exposure and response prevention.
Okay.
Yeah. I think you might like the second one. The second one is the third stopping behavioral health that we offer here, which is a form of a technique that focuses on you interrupting the thoughts of the repetition that you're going in with. So basically, it identifies what stresses you. Basically, repeating the act of locking the door is stressful because it takes time, and sometimes you're late for appointments because when you're going over and rechecking over and over, the time that you're supposed to use for other activities, it bites into it and it affects it. So the second thing is you focus exclusively on the thought and you interrupt the behavior and the thought by actually doing something that you know that is making it clear that the door has been locked, the car door has been locked, and you can move on to other things. A way that I'll suggest to you for this second thought of thought stopping is like using a camera to snap the door when you lock it, or the car door. For starters, over time you'll be weaned off search, but it's just to let you know that I've done this act, I can move on to the next step. That's another one that can help, and it's called the thought stopping one. I'll give you the third one, and if you are at any time, if you have any question, you can stop me and ask a question. But the third one is talking about the progressive relaxation. This is a way of your muscle relaxation. This involves your body parts, because it might be that you're tensed because of the activity that happened like almost a year ago, the breaking. But we want you to come to a reality of breathing in and breathing out. So when you breathe in and breathe out, it's an intentional action that relaxes your body and your muscles, so that when you get to the door and you lock it, you know that you've done the action and you can move on to another thing. Also, when you go out to the car, when you get out of the car, you can breathe in intentionally, breathe out, relax your muscle, free your mind, reduce your anxiety, and lock the door. That's one act, and you can move on to other activities too. So those are the 3 options I have for you. Feel free to ask me any question, or which one do you think sounds
I really
right
like
for
the
you?
second and third one.
No, that's good.
I I think trying to relax and take deep breaths in and out will really help.
Yeah.
I never thought about that.
Yeah, it will. And maybe we could start by showing an example of what that is about by using our door here, so that we
Okay.
can show how you can close the door. Once. Okay, can you, let's go on.
Okay.
So basically, you have your phone with you, right?
Yeah.
Okay. Okay. So we're going to be using the thought-stopping cognitive behavioral therapy
Okay.
in trying to de-escalate the anxiety that comes with repeating of the same action that takes time and takes out of your time, basically. So this is the door, and I would like you to like open the door
Okay.
like this, okay, and consciously make sure that the door is locked,
Okay.
and you could take a picture. When you take a picture, you can see that it's locked, and you move on to other activities. Do you want to repeat after me? And do
Okay.
Good. Good job.
Door.
Great.
Take a picture.
Perfect. Do you feel that's something that you can do for starters?
Yeah.
Over time, definitely you could definitely not do that, but for starters, so that you don't go repeating the same action over and over again, I think this is a good start. What do you think?
I think so.
And the other one is the relaxation method. You can also use that as a backup. So when you take the picture, you can and breathe out, relax yourself, and move on to other activity.
Okay.
So that the neighbors won't be bothered again with you locking the door and your car door over and over again. Does that sound fine to you?
That does.
Okay.
Thank
All
you.
right. Thank you very much, Ms. Devon.
Are you sure you think the door is locked or?
It is.
Yeah.
You can check it on your phone.
Oh, okay.
It was nice speaking with you, Ms. Devon.
Thank you.
So I think I'll give you an appointment for the next 2 weeks so that we can evaluate how far you've gone with the progression and we can know how to go from there. Because over time, you learn to lock the door once without needing to take a picture and move on to other activities. Does that sound fine?
Yes.
Okay, so I'll
Thank
see
you
you
so
in
much.
2 weeks' time, Ms. Devon.
Okay.
All right, thank you for coming in. It
Mhm.
was nice meeting you.
You too.
All right, thank you, bye.
Will you be here when I come next week?
Sure.
Okay.
All right, thank you.
Thank you.